Hello and welcome to this special ACR preview podcast brought to you by the Immune-Mediated Inflammatory Disease Forum. My name is Grace Wright, and I'm a consultant rheumatologist and the president of the Association of Women in Rheumatology. And I am joined today by Philip Mease, Director of Rheumatology Research at the Swedish Medical Center and professor at the University of Washington School of Medicine in Seattle, and Atul Deodhar, professor at Oregon Health and Science University in Portland. In this podcast, we'd like to introduce some of the abstracts and sessions we've highlighted so that you can better plan your time at what will be a busy and exciting Congress. The annual ACR Congress represents an important gathering of people and ideas in the world of rheumatology, allowing rheumatologists to engage with the latest data for therapies that impact their clinical practice. ACR 2024 offers an extensive scientific program covering a wide range of diseases and treatment options delivered through symposia, poster sessions, presentations, and more. The IMID Forum is here to help direct you towards the most valuable content that will help you to stay up to date with clinical practice. As with previous years, we will bring you daily highlight podcasts and an overall Congress review to help you get the most out of this year's ACR. We have identified over 50 abstracts this year covering key IMID topics. Our highlights are separated into 3 individual preview brochures covering RA, PSA, and axSpA. You can find these brochures over on the IMID website now, which includes all the session times for the key abstracts we've selected this year. If you would also like to keep up to date with lupus at ACR 2024, be sure to visit lupus-forum.com, where you will find a preview brochure featuring the steering committee abstract selections in this indication. Let's take a look at some of the IMID selections this year, starting with PSA. Philip, over to you.
Thanks so much, Grace. The first area we will be highlighting is PSA, where there really is a lot to look forward to at this ACR. First, let's talk about guselkumab studies. At this year's ACR meeting, there's a lineup of posters and presentations all about guselkumab for PSA. Let's dive into what you can expect. First up, Alexis Ogdi is presenting a post-hoc analysis of 3 guselkumab studies. She's looking into how prior TNF inhibitor treatments and baseline disease activity influence clinical improvement thresholds in patients with PSA. Then we have Pavitra Srinivas, who will provide a real-world insights on treatment persistence, comparing guselkumab to interleukin-17A inhibitors. Next, both Laura Gosek and Stefan Siebert are sharing findings from the PSA bio and observational cohort study. Laura Gosek presents 6-month interim results showing comparable persistence and effectiveness for guselkumab and IL-17 inhibitors. Meanwhile, Stefan Siebert highlights improvements in patient-reported outcomes related to the impact of PSA, emphasizing that patients perceive similar benefits with both therapies. In addition, there's a post-hoc analysis from Anthony Todd revealing insights into achieving low disease activity in guselkumab-treated patients, regardless of their baseline characteristics. Oyadaran Adilakun will also discuss guselkumab's efficacy in biologic-naive PSA patients with severe disease activity, demonstrating robust clinical outcomes. But that's not all. Lihi Eder will delve into guselkumab's domain-specific efficacy in both males and females with active PSA. And finally, Toby Thomas is presenting an analysis of guselkumab's effects on CDAPSA disease activity state and how it associates with long-term radiographic progression. How about bimekizumab? There's a lot of exciting news about bimekizumab as a therapeutic option in the clinical management of PSA at this year's meeting. As you're aware, bimekizumab is an IL-17A and IL-17F inhibitor that has been approved in psoriasis, and in the United States has been recently approved for psoriatic arthritis and both non-radiographic and radiographic axial spondyloarthritis, and has been approved in Europe for a longer period of time. William Tillett will discuss findings from two phase 3 studies that show how achieving stringent disease control criteria with bimekizumab positively impacts work productivity in PSA patients. Then, Laura Gosek returns to explore bimekizumab's impact on disease burden reduction using the PSED-12 questionnaire. On Sunday, Elaine Husney will present data from two phase 3 studies demonstrating how bimekizumab's control of swollen joints leads to significant symptom improvement for patients with PSA. Additionally, Irene van der Horst Bruinsma will discuss low uveitis rates in PSA and axSpA patients treated with bimekizumab. Meanwhile, Jesse Walsh reviews long-term efficacy data for bimekizumab, highlighting up to 2 years of sustained response in active PSA. Finally, I'll be presenting on the long-term safety and tolerability of bimekizumab from phase 2b and 3 trials. I'll also share 2-year results showcasing sustained improvements in pain and fatigue for PSA patients treated with bimekizumab, demonstrating its potential for long-term symptom relief. How about secukinumab? This is an IL-17A inhibitor that we've been using for some time. Secukinumab is also making a strong showing in PSA at this year's ACR meeting. First, Laura Coates, a fellow IMID steering committee member, will share pooled results from 4 phase 3 trials. She'll examine the time to clinical response across various disease domains in PSA patients treated with secukinumab. Then Gonul Hazal-Koch will present 12 and 24-week findings from a treat-to-target study of early PSA, comparing early secukinumab initiation to standard care. Additionally, our co-host Atul Deodhar will report safety updates from a pooled analysis of 69 clinical trials covering PSA, axSpA, and other conditions treated with secukinumab. Predictors of treatment response are also in the spotlight this year. Stylianos Georgiadis will discuss predictors in PSA patients initiating secukinumab based on data from the EuroSPA collaboration. Alan Kivitz will explore clinical response predictors to intravenous secukinumab in PSA, underscoring factors that influence therapeutic success. And finally, in terms of mechanism, the JAK and TYK2 inhibitors. The importance of JAK and TYK2 inhibitors in PSA treatment will be thoroughly explored this year. Alexis Ogdi will present data comparing the effectiveness of tofacitinib monotherapy versus combination therapy in PSA patients. She will also provide insights on the real-world effectiveness of upadacitinib in PSA patients previously treated with TNF inhibitors, highlighting upadacitinib's impact on pain and quality of life outcomes. Peter Taylor will continue the discussion by reviewing upadacitinib's early benefits in pain control, long-term disease management, and quality of life improvements. Moving on to TYK2 inhibitors, Alice Gottlieb will present data from a phase 2b study on zasocitinib, or TACT-279, highlighting early efficacy in PSA patients with skin involvement. Moreover, I'll be presenting phase 2 data on zasocitinib's ability to help PSA patients achieve remission and further improvements in disease activity. Lihi Eder will further explore how baseline characteristics influence zasocitinib's efficacy in a phase 2b study. And finally, I'll present findings on deucravacitinib's effect on pain-associated biomarkers in PSA, demonstrating its innovative action as a selective TYK2 inhibitor.
Now, moving on to rheumatoid arthritis, there's a strong focus this year on both existing as well as emerging therapies for its clinical management. Let's start with upadacitinib. Upadacitinib's role in RA management will be extensively examined at this year's ACR meeting. To start, Takaya Fuji will share surveillance data on upadacitinib's effects in Japanese patients, covering both safety and efficacy. Fellow IMID Steering Committee member and axSpA podcast host Hideto Kameda will present 5-year efficacy data from the Select Sunrise study, demonstrating upadacitinib's sustained benefits in Japanese patients. Sabino Ciciriello will discuss upadacitinib's persistence in Australian patients. Mira Cho will provide hematological impact comparisons between upadacitinib, tofacitinib, and baricitinib. Additionally, Manish Jain reports rapid pain relief and improved patient-reported outcomes in RA patients treated with upadacitinib. Vanessa Hernandez discusses factors influencing upadacitinib persistence and risk minimization. And then real-world insights from the RADIUS cohort will be presented by Jose Miguel Saqui Sabater, further exploring upadacitinib's long-term outcomes. There's also extensive research on many of our other JAK inhibitors in rheumatoid arthritis being presented at this year's ACR meeting. In fact, Kim Lauper will discuss a comparative speed of action between JAK inhibitors, TNF inhibitors, abatacept, and interleukin-6 inhibitors in RA treatment. Stefan Kleinert will present findings on JAK inhibitor use before and after EMA safety advisories, including an analysis showing greater persistence of JAK inhibitors over biologics in RA from the German RADAR database. Christian Lude highlights how neutrophil markers can predict treatment response with baricitinib. And then addressing cardiovascular concerns, Kanish Hakobayan will explore the impact of JAK inhibitors on cardiovascular risk in RA patients. In the Sunday sessions, Roy Fleischmann will further assess the relationship between disease activity and adverse events in upadacitinib trials. And finally, Yurilu Gonzalez Moret will conclude with outcomes in RA patients treated with JAK inhibitors. Interstitial lung disease is a really important component for many of our patients with rheumatoid arthritis, and this year also brings new insights into ILD in our RA patients. Ana Serrana Combaro will discuss ILD progression in RA patients treated with abatacept and baricitinib, and she will also present clinical findings on upadacitinib in RA patients with interstitial lung disease. Following that, Hari Prasanna will provide a systematic review on the global prevalence of ILD in RA. On Monday, Jérôme Avouac will present data from the MAGIC-SFR registry assessing ILD incidence among RA patients treated with JAK inhibitors, adding a comprehensive view of ILD management in RA.
Finally, let's take a look at the abstracts we have picked out for axial spondyloarthritis. And I'm going to start with bimekizumab in axial spondyloarthritis and psoriatic arthritis. Bimekizumab's efficacy in managing axial spondyloarthritis and PSA will be significant focus at this year's ACR meeting. First up, Helena Marzo Ortega will present 2-year data highlighting sustained symptom improvements for patients with axial spondyloarthritis. Fabian Proft will share results from 2 phase 3 studies that demonstrate bimekizumab's ability to maintain stringent clinical responses over an extended period. Walter Maximovich will then discuss MRI findings on inflammatory and structural lesion improvements in the sacroiliac joints of axial spondyloarthritis patients treated with bimekizumab, and fellow axial spondyloarthritis podcast co-host Xenophon Baraliakos will share the data indicating minimal radiographic progression over 2-year period, again in patients with axial SPA treated with bimekizumab. As already highlighted by Philip earlier, Irene Vandenhorst Bruinsma will present long-term data on low uveitis rates in patients with axial spondyloarthritis and PSA treated with bimekizumab, underscoring its safety profile. Lastly, Leanne Gensler will discuss remission based on objective signs of inflammation versus ASDAS scores, providing further insights into remission metrics in axial spondyloarthritis. There is also interesting comparative analysis of IL-17 inhibitors and anti-TNF therapies in spondyloarthritis at this year's ACR meeting. Jakub Zawada will present data from the Czech ATRA registry demonstrating the superior effectiveness and retention of anti-TNF therapy compared with IL-17A inhibitors in ankylosing spondylitis after the failure of first anti-TNF treatment. Diego Benavent will discuss a meta-analysis on the efficacy of biologic DMARDs in early versus established axial spondyloarthritis, offering critical insights into the importance of disease state when selecting therapies. In a separate analysis, Denis Podubny will present predictors of radiographic spinal progression in axial spondyloarthritis patients treated with IL-17A or TNF inhibitors, supporting a more personalized approach to long-term disease management. Thinking about secukinumab in spondyloarthritis, the secukinumab's role in treating axial SPA, PSA, and psoriasis will be closely examined this year. My fellow IMID steering committee member and axSpA co-host Sofia Ramiro will present a post-hoc analysis on secukinumab's efficacy across age groups, comparing outcomes in patients over and under 40 years old. Then I'll contribute to the discussion with pooled safety data on secukinumab across multiple conditions, including axial spondyloarthritis, psoriatic arthritis, and hidradenitis suppurativa. Additionally, I'll be presenting predictors of clinical response in patients receiving IV secukinumab, providing insights into patient characteristics that could impact therapeutic success. Finally, real-world evidence and new treatment approaches will continue to be prominent themes for axial spondyloarthritis and psoriatic arthritis. Xenophon Baraliakos will present a multi-center European study examining patient-reported outcomes for those treated with CT-P13. This is a subcutaneous novel molecule. This is infliximab, subcutaneous infliximab molecule, providing valuable insights into biosimilar effectiveness in everyday clinical settings. Fellow co-host Philip Mease will discuss early versus late clinical response outcomes from the CORE-EVITAS psoriatic arthritis spondyloarthritis registry, illustrating the benefits of early intervention with biologic and targeted DMARDs in achieving optimal patient outcomes.
So we hope you've enjoyed this preview. The IMID Forum has plenty more ACR coverage planned as the Congress gets underway. For a condensed overview of the most important abstracts presented each day, be sure to look out for our daily highlight videos. And after the meeting, we will broadcast our ACR Congress Review podcast, where I will once again be joined by my co-hosts, Atul and Philip. And this will be a great opportunity to listen to our discussions around some chosen abstracts. It's definitely not to be missed. And don't forget to visit imidforum.com and download our ACR 2024 preview brochures, which include details of the faculty's top abstracts. And all that remains is for me to say, enjoy the Congress.